Good afternoon, ma'am. I'm Adeline de Guzman, and for today we will be reporting skin disease, which is varicella chickenpox, presented with my fellow groupmates Arcegono, Maguale, Paz, Sablad, and I. Introduction. Learning to recognize common skin conditions is a skill that is extremely valuable in all areas of medicine. In pediatrics, in particular, it is important to have the ability to identify skin lesions, as such knowledge will enable you to both recognize potentially significant systematic disease, such as meningococcia or chickenpox, and reassure concerned parents. The skin serves as a critical barrier of infection and dehydration, and as such, it is important to keep in mind that disease or impairment of the skin's normal function can lead to significant morbidity or mortality, particularly in infants as they are more vulnerable to heat loss, dehydration, and infection. Varicella or chickenpox is an acute infectious disease. It is caused by a varicella zoster virus or VZV, which is a DNA virus that is member of the herpes virus group. After a primary infection with VZV causes varicella, reactivation for latent infection causes herpes zoster or shingles. So, after natin magkakaroon ng chickenpox, ay babalik ito, which is tawagin nating shingles. Objectives. By the end of the topic, student nurses should be able to describe identification of chickenpox, name the infectious agent of chickenpox, identify the occurrence incidence of chickenpox, name of the reservoir of chickenpox, explain the mode transmission of chickenpox, identify the susceptibility person to chickenpox, state the incubation period of chickenpox, state the period communicability of chickenpox, explain the method control of chickenpox, prevention measures, control of patient contact, and immediate environment. Explain epidemiological measurement of chickenpox, describe disaster management measures of chickenpox, describe international intervention of chickenpox. So here, as you can see, we have a database, a varicella age-specific incidence, United States. So nursing healthy history. So we have here a demographic data. So chickenpox is a common disease with the most cases occurring in the pediatric population. Since the introduction of widespread pediatric immunization in the United States in 1995, the incidence of varicella has declined significantly, approaching a decline up to 90%. Mortality from varicella has also declined since the initiation of U.S. vaccination program, with mortality decreasing by approximately 66%. Countries with tropical and semi-tropical climates have a higher incidence of adult chickenpox than the countries with a temperate climate, for example, US and Europe. Chief complaint. Anna is complaining to her mother that she is not feeling well. She felt itchiness all over her body. History of present illness. Anna is complaining to her mother that she is not feeling well. She felt itchiness all over her body. So upon checking, Anna's body temperature is 38 degrees Celsius. She has reddish fluid-filled blisters on the chest, back, and face. It is spread over her entire body, including inside the mouth, eyelids, and genitalia area. Anna is not feeling well. She is irritable and crying. Past medical history. Bronchial asthma. She had a bronchial asthma when she was 2 years old. Family history. Anna's grandfather died due to an asthma attack. Social and personal history. The family is in the middle class. living in a small apartment in town. All of the family members are vaccinated with varicella vaccines except Anna. So we have here a review system. So we, as you can see, we have skin and we check rashes and itching. Nursing health history. General description of client. Anna is a 7 years old girl with a grimace face and has a body temperature of 38 degrees Celsius. She has reddish fluid blisters on her chest, back, and face, and it is spread over her body, including inside the mouth, eyelids, and genitalia area. So Anna is not feeling well, irritable, and crying. So we have here a functional health pattern. Pattern describes and patient findings. The next one is physical examination. And the next one is laboratory findings. We have a polymerase chain reaction or PCR testing, which is result positive. So blood testing, so zinc smear. Next one is pathophysiology, highlighted patient manifestation. Chickenpox infection appears 10 to 21 days after exposure to the virus and usually lasts about 5 to 10 days. Rash. Once the chickenpox rash appears, that goes through the three phases. Raised pink or red bumps, which is breakout to over several days. Next one is small fluid-filled blisters forming from the raised bumps over the body over about 1 day before breaking and leaking. The last one is crust and scabs, which cover the broken blisters and take several more days to heal. Fever. Fever is an accompanying symptom of chickenpox. Headache. Headache may appear 1 to 2 days before the rash. Body malaise. There is a feeling of generalized tiredness all over the body. So we have here a nursing process or a nursing care plan. Assessment, diagnosis, planning, intervention, and evaluation. Drug study. Antiviral therapy. The routine use of acyclovir or varicella in a healthy children is recommended by the AAP if it can be given within 24 hours after the rash first appears in children older than 12 years old. Those with chronic cutaneous or pulmonary disorder, those on long-term salicylate therapy, and children receiving corticosteroids. Varicella zoster immune globulin. So, Varicella zoster immune globulin was approved by the FDA in December 2012. It is indicated for high-risk individuals within 10 days, ideally within 4 days, of chickenpox exposure. This agent reduces complications and the mortality rate of varicella, not its incidence. Next one is antibiotic therapy. Suspicion of a secondary bacterial infection should prompt early institution of empirical antibiotic therapy until the results of culture studies become available. Next one is medical and nursing management. Primary varicella infection in a healthy child is a rather benign disease that requires symptomatic therapy only. Next is nursing management. Treatment approaches include supportive measures, antiviral therapy, administrations of varicella zoster immunoglobulin, and management secondary bacterial infection. Next one is method, medication, health teaching. Next is resources, material resources, visual aids, and low-cost materials that is actual demonstration, human resources, time and effort of the part of the nurse and family. So references is Nurses Lab or Google. So thank you for watching.